Just gonna go over some basic ideas of just like how to utilize the foam roller, just the stuff that I use in my notebook. Alright guys, so the first thing we're going to go over is the T-spine, how to roll out the T-spine. If you have the spiky rollers, I'd recommend you get one of the smooth rollers. So the biggest mistake I see people doing with the T-spine are two things. Firstly, they'll kind of get on there and they'll just scratch their back with it, which, I mean, if you think about how you stretch, like when do you ever go to stretch your hamstrings, right? Like you're going to try to hold that position for a minute. So the way I always explain it is you're going like you're in a school zone. It should take you about 30 seconds to go about that far. Very slow moves, and even when you're on here, kind of taking your time. And if you find one of those spots that might be particularly tight, depends on the neck issue, depends on the spine issue, just taking your time, staying on that one spot rather than just scratching my back, park your glutes, and actually work through some extensions. So if someone's very tight, you might have them hold their neck to support that. You can come here, and then eventually reaching the arms out to get even more of a T-spine extension. The other thing you'll see a lot of people do is like, oh, my lower back's tight. They come down here. You're just pushing your spine into the deeper position. There is foam rolling stuff you can do for the lower back, but I wouldn't recommend just kind of scrubbing out the lower back in that fashion. So the biggest thing with the T-spine, I would say, is like slow it down. People are gonna be should be uncomfortable, not painful necessarily, but just taking your time as you move through that. Any questions on that? Everybody good with that? Cool. The next one we're gonna do, again, this is kind of the general one I do, just for the idea that everybody's back is tight. We're all sitting like this all day. Stretching out like this is a good idea. Our shoulders are rolled in, and that's where this chest gainer comes out. So I was having a lot of neck problems. So I work with, I don't think anyone knows Ken Charleston. He used to be, Steve knows Ken. So he used to be a trainer here. He graduated to Doctor of Physical Therapy. Gonna try to get him in here for a CANI. But he actually gave me this one to help with some neck trouble I was having from jiu-jitsu. But basically, and I want you guys to try this, make sure your head is supported on the foam roller. So it's a little difficult to do if you have the short one. But you're basically gonna support your entire spine on here. And then to work through the chest and kind of some shoulder flexion, we're gonna come up like I'm doing a chest fly. And you can work through a different range of motion. So I'm bringing my palms up, knuckles down, trying to get my knuckles to the floor. So you can do this kind of butterfly pattern, come in opposite directions. You can also just go straight out like a regular chest fly, but it's gonna let you get through a range of motion, kind of while relaxing the rest of your body. So this is a good alternative if you have someone's too tight to do that doorway stretch where you just lean on the doorway and stretch out your chest. This is a good way to kind of get them into that. So what I'll normally have people do is kind of flap your wings until your arms are down to the opposite angles. So you start with the right arm up, left arm down, and you just keep going until you're switched, and then you work your way back to where you started from. Again, just a good way to stretch out the chest and shoulders. You can hold hands if you want, guys. We're close. Jinx. And you guys can come out when you feel ready. There's a ton of different ways you guys could do this. You could do repetition count with this. You could just put on a 1-minute timer. You even just say, do this until you feel like it loosens up a little bit. Generally, people just keep going and tell them to fill that out. Any questions, comments, anything you guys do for the T-spine?
Yeah, I just like to, when you were talking about earlier, like what I'll do, because again, a lot of people have that kind of kyphotic curve going on, just like this in the T-spine. So the big one that I do is just having people lay, like you were saying, like this way on the foam roller, and then just working on that like extension.
Yeah, the opposite of a crunch.
Yeah, and I think that most people end up really feeling good after doing that, because they never can really get themselves in that sort of extension. And like the foam roller is really, it's just like a great tool to use to just help like extending over something.
Yeah.
So that's a big one that I use with a lot of people.
Yeah, I would agree with that. I think a lot of the time just kind of let them roll out and feel what spot they feel that at, and then it's like, all right, well, let's try to open up in that area. Because if that's the spot that they can't move at, it's probably the spot.
Were you gonna go more into the lower back too, or I was just gonna say?
No, please.
Well, I was just gonna say because you were like the foam roller is not like a great like thing for the lower back, but it's really not. You can't. But like I don't know. Has anybody? I know you know seen the peanut that we have in here. Like I found.
Would you mind coming up, Scott?
Yeah, I found that to be, like, I've had a lot of low back issues over the years. We have one downstairs in the back room. And like,
You can also just take two lacrosse balls
like,
together to make
it
this
became
great
like,
to give.
it became popular, so they actually made them. But the guy who did Supple Leopard, Kelly Starr, he's the one that kind of started this. He just like literally taped two lacrosse balls together, but it fits perfect for like your erectors and your QLs. Riding your spine without, like, you know, it's got like the perfect crease here for your spine. So like even just like you said, like not even like it's useless to just roll back and forth on the foam roller.
Like you can leave that in the spot.
But like literally, like whenever I had issues, and I've done this with clients as well, because lower back pain is like quite common. Like, you know, helping people find it on the spot, and then like first just laying there, have them lay on there, and then doing stuff like pulling a knee in and holding, and pulling the other knee in and holding, and then you can even
if you're sadistic.
yeah, I mean, and it's like, it's not the most comfortable thing, but it really helps with loosening, again, the fascia and the tightness that develops in the lower back. So like, I haven't used it as much, but I used to use it all the time with people.
Yeah.
And so just something that like you guys could utilize if, you know, you have clients who are complaining about like chronic lower back issues.
Yes. And just as we have the peanut out, guys, while we're talking about it, another good one if we're talking about like shoulder flexion, right?
Yeah.
Overhead, that's flexion. So actually taking this and again, right, it's going to fit in those spaces in between the vertebrae. You got to be careful, right? If someone has a bulging disc, I'm probably not going to have them flop around on this. But, you know, we're trainers, we're professionals, use your judgment. But it also fits really well between the wings of the scapula. So putting it back here, and you can do this on the wall. All of this is scalable to do on the wall versus on the floor. The more gravity and pressure you have on, obviously it's like a massage. If you can't breathe, it's probably too much. So you can lay down and kind of do some, again, that same kind of extension I was doing on the door. If you're locked up in the back, you can kind of break up those little Rice Krispies in the back. You can work on your shoulder extension through here, pardon my belly hair, right? Kind of different ranges of motion like that. So if you have someone who really can't get their shoulders back, it's a good indication, like, are they jacked up in here or are they jacked up in the chest? Emily, saw your hand up?
Yeah, I was just gonna say, well, this is kind of moving away from, but
No,
also
no.
kind of staying with the thoracic spine.
Go
When
for
you're
it.
laying on the roller like this, I have people do this a lot. Just basically kind of
Mhm.
squeezing in your shoulder blades and then coming up overhead. This kind of helps people like stretch and work through flexion too, like shoulder flexion. Because a lot of the time, like, you can try to have your client like come up here against the wall, but they can't like, they
Even
don't
raise their
have
arms.
the range to get up here.
Yeah.
So when you have the gravity like pushing you kind of into a stretch too, that's a good way to work through that range of motion and work on your shoulder flexibility.
100%. And that's a great progression, right? Like all of this is on a sliding scale. If they can't do it with this, maybe they can do it with the roller. If they can't do it with the roller, maybe they can do it standing up here with their back on the wall. So you can do all this same stuff, even just like Baloo the bear, scratching his back on the tree, come up here, kind of let that relax a little bit. Again, this isn't gonna fix their problem, but it might get them to the point where they're comfortable enough to like, okay, I can kind of get into that. But it's using your judgment and figuring out how to make it harder, the progressions, and how to regress it to make it a little bit easier.
What's the technical name of that? Like,
The peanut.
it's called, you know.
Yes.
Yeah.
Can you look it up on Amazon and go, you know.
Probably, yeah. Again, just yeah.
Just go public.
Yeah. But again, if you just take two lacrosse balls and take them together, this is probably
Yeah,
like
just go to Google,
30
type in
minutes.
peanut roller, and that's exactly what comes up.
Yeah.
And it, go ahead.
I just have a question.
No, go for it.
That might
I'll try,
help all of us.
I'll try to answer it.
If we have a client that has a hard time like lifting themselves up to get onto a foam roller, to do like a
You're saying if they're too
pec
fast.
stretch, either that or they just like
Too frail.
they're fragile or
Okay.
they have
Like
like
an
firmer
old
shoulders.
Okay,
Yeah.
yeah.
How would you recommend that somebody gets on a foam roller like that, or would you do something completely different?
Depending on what you have available, so like one good method might be, we have massage tables, we have bolsters, so even that, having a softer bolster under them might be enough to kind of get some stretches. Just for a client example, are you talking about Chris Cantor?
No, actually, I'm talking about Celeste. She's
Okay.
part-time getting
Yeah.
on here, but that's a really good stretch. She's just laying like this for her because she has really tight pecs.
Mhm.
Just like her whole upper thoracic region is just kind of fucked.
Yeah, so like one reason could even be like bring the floor up to her, so you might use something like stacked up mats or something, just so this way when she goes to get up, she doesn't have to get up off the ground, she kind of has a little bit, and then just physically helping her up and down off the ground.
Yep.
And again, like using the wall as something, you could even kind of hold the roller there for them. Steve, got borrow your hand? You could even hold the roller there for them and kind of let them do that off the wall, and then just so if they come off, it doesn't drop down, right? You're still gonna have that support, and then they can kind of stretch their back out in that way. You just gotta be careful, they're not like knocking their head back into the wall, so it's again, how much do you trust this person? Like if I had, I sometimes help the physical therapists. I know some people are new, I'm in nursing school, I'm like finishing up my rotations, but I'll help the physical therapist with stuff like that, and it's a lot of it is judgment calls. Is this person safe to do this? Do I feel comfortable doing that? So, but yeah, I would say either elevate the surface up to them or have them just do it against the wall where they can do it standing. Might not be as beneficial, but those people I always tell, get in with Steve, get in with Felix, any of the massage people, and they'll actually be able to go hands-on and kind of break that stuff up.
Okay. Cool. Thanks, Bill.
Any other questions, guys? Again, if you have a good example, please come up and show us. This isn't like, you know, a professor thing. It's trying to make it a round table.
I was gonna say one of my favorite stretches I like to do for like, instead of like a lying twist almost, 'cause I feel like if you're really flexible with a lying twist, like I don't feel much at all.
Right.
I'm bendy, I'm flexible, but as soon as I get this foam roller under my back or even mid back, and then I have more stretch.
I don't know how many of our clients are doing
I
that. But right, so like, again, so if you had Anna as a client and she's like, I feel tight here, she doesn't feel stretches, I probably you don't need to stretch anymore in that area. But, you know, if
And
for
so I
whatever
also
reason
give like
they
a
do.
good crack too. I mean, you don't have to take it for your clients, you can take it for you, but like.
Yeah, but again, that would be kind of on that continuum. Like maybe Anna wants to stretch that, she doesn't feel anything, so she figured out a way to progress through that stretch. The next thing, we just talked about, right? So like stretching out the back, tightness in the shoulder blades that a lot of people will get. Another big one you'll get is tightness through the pecs. So again, if you think about that following the grain, if you squeeze your pecs, you're gonna squeeze it. Eli, flex your pecs, you got bigger pecs. Right? They come together in the center. They're attached here and here. So following with the grain, you can just, I'll use this, but a cross ball, a tennis ball. The density of the ball will have a big effect on how intense that stretch is. So using a softer ball, they have like yoga balls that are super squishy. If you want to be sadistic, you have golf balls, lacrosse balls. But just kind of working in on that pec with your arm in different positions. So here to here, figuring out like where they feel that the most. And I always think of painting with the grain. I always think of like a paint roller, kind of coming side to side. You want to paint all the way down through that muscle. And kind of pointing out, guys, the anatomy of it, of where it is. Because if you say roll out your chest, some of your clients might wind up down on the ribs, right? You've had that happen, right? Like people don't know where their muscles are, so pointing that out to them so they know where to stop, when to stop. I always say if someone's rolling their back out, they're like, oh, they go all the way down to here on their lumbar spine. I always say don't go past your ribs, right? Because the ribs is an anatomical landmark they'll actually know and be aware of. This is not necessarily, you guys don't gotta get up, you just turn around. But a really good one, it's easier on the Smith machine, you can use a barbell for the same thing, just as does anyone not know the door stretch for the chest? Lean in a doorway, and you kind of let your body fall forward with one hand on each side of the door. Is a really good one to give clients, because I mean, unless they're homeless, they're gonna have a door to do that on somewhere. A good way to advance past that, kind of just leaning in, you could go palms up, palms down. You can adjust the height of this, and then eventually even getting into on the rings. But even for here, right, so skin the cat would probably be like the most advanced example, like we're actually like going through almost a dislocation. But just coming in here and allowing them to stretch there could be another good one, just because sometimes the doorway stretch gets boring. You want to add up some variety, and with the rings is nice because you can actually go through some shoulder rotations, some active stretches, rather than just, okay, how many times are we going to lean in on the doorway, right? People get bored and they love novelty. I focus more so on that. And again, guys, we're lucky enough to have Steve here and some other masseuses. Encourage your people to get massage. That's the best version of myofascial release you could get. Anything like that, Steve?
I like that.
Cool. Yeah, Steve likes business.
I got a question for you.
Go for it,
Do you prefer smooth form roller or like the one with the little things in there? I don't really like that one too much.
I can't relax on that one. I've had a couple clients, I don't know if it's like a fetish or what, but they like the spiky one. They like the, but whatever your client can tolerate, right? So, for example, today I had a couple that I was training. I was having them both roll out, and the husband was able to tolerate it totally, made some faces, nothing too bad. I could see the wife was struggling, and she was kind of doing one of these. You can tell by the strain in the voice and if their ease of breathing, like, oh, maybe I need to get the blue one, get the white one, but if you can't relax on it, like, what are we doing? You're just gonna be squeezing the whole time, which is the opposite of our goal, you know what I mean? And same thing for lacrosse balls. Like, if you can tolerate a lacrosse ball, that's awesome. If you can't, maybe a tennis ball or one of the yoga balls, something a little squishier might be better. Anyone else?
I like how you said go with muscle contract. I never really how you contract them.
Yeah, just like, again, like that go with the grain idea. If you guys can, I'll see if I can find it online on my pirate websites, but if I could get a free copy of Anatomy Trains. It's a really good book. It reads like an anatomy textbook, so if you don't have like an exercise science background necessarily, it's kind of hard to get through, but just the idea of like those patterns and thinking of like training someone in those patterns, it's like a tennis player. It's gonna be a lot of rotation, bending, extending, lunging. So you can train them like in the idea of those patterns of the body rather than just like, you know, training the muscle and not the movement.
Bench press.
Right, yeah, like if those are your patterns of sport, if you're a power lifter, that's fucking great. You know, I love people to be able to squat.
But it's not compatible with, those movements aren't compatible with a tennis player.
Right,
You know,
exactly. Exactly. I have ADHD and don't remember anything I wrote down.
Join the club.
Yeah, pretty much all of us, right? So, this ball again. So another good way to trick this, guys, if I have this lacrosse ball, it's a very small surface area, so it's gonna be very specific to what I need. If you use a bigger ball, or I always tell people softball, baseball, because that's probably what they're gonna have at home somewhere in their garage. I don't care what they use as long as they do it. But a lot of the time we're sitting on our asses all day, right? Lower back gets tight, glutes get tight, and especially if you train a lot, your glutes are super tight. So just working on the wall, again, you can do this on the ground, but just going with the grain. So I'm kind of at the top of my top of my pelvis here, not on the lower back. Again, explaining that anatomy, because if I say roll out your glutes and you're smashing this into your lower back, might not help, might make it worse. All right, back your ass up into the wall and just kind of side to side. Explain to them that they can use their hand. They don't have to like try to twerk on the wall to try to get it in the right spot. And I always use the analogy, you're trying to paint the whole glute with this ball, right? So working all the way down. Another good one is the piriformis. Everybody know what the piriformis is, right? Little muscle in the glute. Sciatic nerve runs right behind it. If you ever heard of piriformis syndrome, pulling on that sciatic nerve, they get some sciatic nerve pain. So I've had a few clients where you can actually relieve some of that sciatic nerve pain with that. Make sure they can tolerate it. Again, like a softer, larger ball is gonna work a lot better in the beginning. So throw my leg over like this. You'll say, find your piriformis. They're gonna be like, how do I find it? You're gonna say, you'll know when you find it. And just working side to side. It's kind of in that little divot. Here, let's, I don't know how many balls we have, but share, try to roll out your piriformis high. So just with that leg folded over. Crossballs up here? You can still like it's not as targeted as the ball, but you can still kind of get some semblance of that like on a throw and roll. Like I've done that with people like plenty of times.
If you want to get closer to the ball, get on the edge.
Yeah. Oh, Sammy with the big brain. So yeah, and then just kind of rocking side to side in the saddle, which can actually be a little bit more tolerable than the ball sometimes. But yeah, it's kind of like up here towards the top of the glute and digging in here.
Eli's one of those people you have to show the.
Yeah, the proper anatomy. So here, no, let's do this. Sit up. Stand.
Focus performance.
Dude, what is he doing? He's like Bryce
Yeah.
Christie. Crap falling out of the closet.
So when you have like your XL kindergartner client teach, so it depends on hands-on, right? So like we had this issue a while ago where someone came in and was hands-on with someone without asking. It's very inappropriate. The general instruction I would give for that is you're never gonna poke people as much as I like to poke Eli. Back of the hand towards the knuckles, even going like this, is a lot better than if you go like that, especially gentlemen when you have female clients. Not some clients would be. But so like using this and being like, yeah, you want to feel it here, right? And kind of gesturing towards that, or even using yourself as the example. So Eli, what I want you to do is sit down on the foam roller and kind of find towards the top of your glute. So if any of you guys want to try this, go for it. So
Sorry.
find out what the troublesome side is. I would start on the non-trouble side, so they're not just like, oh god, like it's kind of touching the boiling water and jumping out of it. So hold that leg over.
Keep your butt on it. Sit on it like a
So right here, looking at Eli, he's too tight to get there. Go up higher, ball. His leg can't. Right? He might not be able to do this. So he might be a good case. Yeah, just come on.
Yeah, but I feel like if he were to maybe like lean onto like that hand and take his right hand off of the ground,
That's
maybe
right.
that would help a little bit.
I think if you just did it right, that would help a little bit.
Hey, we got an XL kindergartner. You be nice. So see if you can fold that leg.
And lean towards that left. Yeah. No.
Yeah, kind of work up and down. So do you feel that? So right there, you're just gonna start try to hit my knee over here. Right, so you can feel that one muscle, kind of that divot that it's, and then bring your foot to the opposite side, right away from my hand. Breathe. Breathe. Let me hear you breathe. Good, yeah. So another good signal, guys, tell them to breathe loud enough for you to hear. Good. Slow.
He's gonna need those loose glutes if he's gonna do a bunch of snatches.
I know, right?
And then to the side, just work on that other
50
side.
pounds? Yeah, no problem. 50 each arm.
Right, so you might have to take it slow, guys. A lot of people, this is like super painful for, so getting them to go slow, they're gonna be like, no, I want to get it done. So like, no, slow, breathe, take it easy. A lot of times with paraformance, this might even be too much to roll it out. So doing, I think, was it you that gave Keith that paraformance stretch where he walked his, can you demo that actually?
Yeah, so I just have him lie down, press his back into the ground, pull his abs in, and you can either have your client, depending on how good their mobility is, pull their top leg or under and through.
Can you show that with the feet on the floor and walking it back? So what he showed me was kind of, if you have trouble through here, being able to handle it, I like to come in here and then actually like floss it through side to side so you could actually feel kind of that point of tension. But what he showed me was like walking this heel back into the glute, which for me, I don't really get a stretch through that same area. But if you have a client who's crazy tight and they can't manually handle this, it might be easier to let them use their leg and hamstring to kind of get into that position, and then even pushing away rather than pulling in. Anybody have anything else to add on paraformis? Glutes? Alright. Glutes are great. Next one, guys, just briefly, to go over the quads. Everybody likes to roll out the quads, right? Makes your butt look good when you're rolling it out. But what people tend to do is they just hit the front of their quad, and then they never really get into kind of the inside or outside of it. So getting into your TFL, especially on the outside, a lot of people get locked up in here. At least I know I do. So again, I use that analogy. It's like a paint roller. So instead of just kind of centering up and going back and forth, right? Even if I'm just going to do it, this is why I like the smaller ones. Going on one side, and kind of go to the outside a little bit. I'm not trying to go all the way out to the side. I was talking about this with Emily a little bit earlier. Your IT band, it's mostly white tissue besides the part at the top. So if you're having someone do this, you can just kind of irritate their IT band. So just make sure you're not going too far. It's like a slight angle to both sides, and you're just trying to paint that entire quad. If someone's got crazy tight IT band, doing some work up here is pretty good. Down here, you're just going to kind of be matching into tendons. Anything to add on that, Steve? You'd probably be able to explain it better than I can.
Yeah, I mean, like, you can definitely get into the vastus lateralis, which can sometimes, like, present itself like IT issues, but definitely glute minimus is, like, where if you were actually having IT band issues, releasing up here is going to release that whole thing.
Mhm.
So, yeah.
Do you think the glute roll would be an effective way to do that, or would you recommend something else?
The glute roll would, the one you just showed.
Yeah, just with the on the wall or the cross ball.
I liked it for the glute minimus. It's such a small muscle. I like to get all the way like onto the side for that one and almost just compress there because it's such a small muscle. That just kind of like rolling and like kind of shifting your weight around on it like that is good. Again, that can be kind of intense. So whether you have like a softer roller or whatever, but it's such a small area that where that like all inserts.
And again, if they can't tolerate it, send them to Steve, and Steve.
Yeah, I was just I would just do it for people. I just push on them.
Yeah, it's much easier. Everybody should get their massage license.
Yeah.
So go off of when you're just talking about the quads. Something that I'll do with a lot of people. It's almost like an active release type thing. So I'll have people here like, and typically I'll do it with a softer roller because I found even for myself, and a lot of people say the same, that when they start doing this, it's significantly more uncomfortable. But like finding a spot that, you know, is like you said, like with the pure form, it's like you'll know when you hit the spot. So sometimes I'll tell people like roll around a little bit, like find a spot that maybe stands out a little bit more, stop there, and then while trying to relax down is just go through that flexion of the knee. And you know, because then obviously your muscles are moving under the tension of being on the foam roller. Yeah. And so that's just something that I found myself and other people say that it really helps with just kind of loosening everything up in that area, as opposed to just doing the rolling, right?
100%. I think a lot of the time that active release, or even kind of like when you're doing manual stretches with someone, what's that? Everything is an acronym. What's the acronym when you're flexing and extending?
PNF?
PNF, thank you. Yeah, almost like a PNF kind of idea, or RKC, like putting yourself under tension and then allowing yourself to relax, going through different motions. Lauren, I know, do you have FRC too? But yeah, but going through like, even if you're doing, on the next one I'm going to show like actually adding like a knee bar in while you're flexing your hamstring. But going through different ranges of motion as you're doing these active releases can be very helpful too. If you're just smashing on something, that's great, but right, like if you're going for a massage and someone just held a pressure point on you, you'd be like, hey, what's going on? Like kind of moving that tissue around, right? It's alive, it's moving.
Yeah, that trigger point hold will work within like 15 to 20 seconds if it's gonna work. Like
Right.
If you're gonna like hold it, yeah, that'll work like pretty quick. Other than that, it's good to kind of do what you said, like move it around, regroove it.
Yeah, and it helps people relax a lot too. That's what I was saying. Like if they want to kind of scratch their back on it, that's fine if it helps them relax, but it's not the end goal of trying to do that. I'm gonna go over one more, guys, for the hamstring cover. That ball, please and thank you. You guys don't gotta move, just kind of turn so you can see me. I like doing this on a bench better than I like doing it on a box because it allows a little bit more room for the leg. But you're basically gonna take this, you can put it on different parts of the hamstring. For me, it's always like right below the glute, I found for most people. But just kind of going around, and to Steve's point, it's another good one. You can roll out this way, or just roll out on the foam roller with a straight leg. kind of going back and forth to massage it out a little bit to get some relaxation in there, just so they can tolerate the position. Flexing in, that's why I like the bench better, because you can have a bigger range of motion with it. And then extending out. And then if you want to, if you have someone who, I would do probably the cars first, so that's just, you find your tibialis tuberosity, if you guys were at the last CANI that I did, and rotating through there rather than just the ankle, so you're actually rotating that shin bone internally and externally to allow it to extend and flex through that same range of motion. So if you have someone who's familiar with cars, you can actually have them do their cars while they're also breaking apart some of that hamstring. So coming inside, outside. You have people I affectionately refer to as motor morons, and they're just like, I'm doing it, and they're just flipping their ankle back and forth. This is fine too. You can take a lot of the pressure off and lean almost off to the side. Some people that'll work for. Some people you can come on here and actually put pressure down on. Again, that's to Casey's point, you might have to find what they can tolerate. And that's the biggest thing with any of this, because if someone's doing this and you're like, this is the best movement, and they squat like this, it's probably not the best movement for them, right? So you choose different exercises, different movements that fit their body. Any questions on this? Anyone
I was just gonna say, when Kelly Starr calls it a super friend, when you have somebody, when you need more pressure, and you have somebody
You
on
want
it.
to demo that when you flip?
Sure, yeah. What would you? Okay. Sure. That would be. Well, no, so it would actually be like the opposite way though. So just flip
like
over.
push it down?
Yeah. So if it was like Bill was rolling his hamstring and he's somebody who could like handle a lot of pressure, but he's not getting enough, you can have somebody legit like put weight down on it as they roll. So it's just the guy who does the book, Kelly Starr. He just demos that as if you have somebody again who needs more pressure, you can have a super friend come and
The other one he demonstrates in the book that I wasn't going to talk about because it's something Steve can do, but not us. Eli and Anna, if you guys are working with your partners, your boyfriends, girlfriends, husbands, wives, just kind of, Eli, I'm going to use you, lay on your belly. So to kind of be able to regulate it, it's a little bit easier to do this way, but you can actually like use your heel, just dig in, right? Kind of same idea, bend and flex this knee, right? So you can actually feel, again, one of the reasons it's good to send them into a masseuse, you'll actually feel the movement where some of that tension is. Oh, maybe I feel some more Rice Krispies down here. We need to scrape those barnacles off. If they're able to do the cars, again, this is a good place to add those cars in where they're rotating and stuff. Again, I don't think it's a great idea to start stepping on your clients and like crack their backs and stuff. We're not trying to get lawsuits.
You can crack my back if you want.
I'll do it after. I'll crack everybody's back. You'll sign waivers, right? But yeah, just as like a different thing to add into your repertoire. If you're comfortable with a client, but I wouldn't really recommend going too hands-on besides just those hands-on stretches that Lisa demonstrated.
Jump on your client's back.
Yeah, just donkey Kong.
Yeah, that's a good idea.
Any questions on that hamstring case?
Not really a question, just like a comment.
Please.
I wouldn't really recommend this for older clients or clients who have knee problems. I guess you could give me some advice on this, but I'd kind of playing around with this. In college, I had tendonitis in both of my knees. I used to try to roll out, kind of trying to be creative, and I found that just sitting here and kind of rolling that new space in between your knee gap just relieves a ton of pressure from your knees. How you feel about that?
Have you ever tried knee gapping too?
Never.
So this is something actually really good if your clients have trouble with knee flexion. So when I had my meniscus tears, my MCL, ACL tears is a big one I used. So you could, a couple different ways to do it. I like to just roll up a towel, make sure it's balled up enough so you have some space. And actually, instead of you were saying, kind of gapping it from the front because you are putting some pressure on the patella, just gap through here. And as you push in, it kind of pulls apart femur and tibia, fibia in the front. Just kind of give you some space in there. And then you can work through different ranges of flexion. Another one a lot of people will do is just kind of up through here, putting the pressure in. We're kind of thinking more of the back of the knee rather than the front of the knee. But that's something you got to be careful about, especially if you're dealing with an injury. Something I'd probably send them to Lou, one of our people at IM, get some approval for that, just because we can't read any of their imaging, right? So if someone gets an MRI, CT scan on that knee, and they show it to you, I don't know, yeah, it looks like a knee, but we're not gonna be able to identify like the structural damage in there. If it's for yourself, I would say do what feels good. Anyone else got anything?
One other thing,
Go
it
for
seems
it.
like the Achilles would be a hard thing to dig into. Is that something you can use any of these things?
I just do like
Two
the
like small.
Achilles, are you saying a damaged Achilles or a, like just you're having like
just tight.
Tendonitis.
You can roll out your calves the same way with the hamstrings. So like either just having the foam roller kind of going from here to here. Just a very basic thing, guys. Don't go over the joints. If you're having someone roll out their quads, I always say stop 2 inches before your knee, because they might go over it and be like, click, ow, they're gone for 6 months. They're hurt, you don't get paid, that's bad. So don't go into the back of the knee or to the Achilles, but sometimes instead of hitting the problem area, kind of go above and below, like what Steve was saying about like a lot of time IT band tightness, it's lower back tightness.
So even a foot? You can go over
Yeah,
the
yeah,
bottom of the
absolutely,
foot?
yeah. So just to go over that real quick, thank you. That's actually a really good thing. So rolling out your feet, guys.
Yeah, I use a lacrosse ball
Right there.
on
You-
a fairly regular
I do it every
regular
day,
basis
like on
to
your bottom
roll
of
my
your foot,
feet.
yeah.
Yeah.
It's okay, it's got to go on the ground anyway. But yeah, so Emily Brown used to be a massage therapist here. The way she showed me, you have a long tendon that runs, kind of the only tendon I'll really tell you to roll out, running up from the heel to the ball of the foot into the big toe. So you can kind of just trace that line down, and a lot of time that'll feel really good for people. And I'm going way too fast, so you really, it's difficult to have people do, right? Even I'm doing it while I'm talking about it. Should take you about 3 big breaths to get to the top. Now I'm not gonna make you watch me do this, but 3 big breaths to get to the bottom. And then rolling out that other pad of the foot, breaking up those little Rice Krispies. Anything to add for the feet, Steve? You did a whole 9 on them the other week.
Yeah, I mean, as far as like rolling and stuff, like,
That was 2 months ago.
yeah, that was a while ago. But
I'm in school, dude.
but yeah, no, I roll the feet often because our feet get so tight from being in shoes and essentially inactive all day long. So that's why like the minimalist shoes exist, the Vibrams and the Vivo Barefoots and stuff like that. So like that for sure too can like possibly affect like your Achilles or something like that. Just tightness, like chronic tightness in your feet, just all day long, every day. So.
It's such an easy thing to do too. You sit on
Yeah,
the
so
couch
like-
and you just have it on your feet.
But yeah, so
Tennis
to
ball, lacrosse ball.
go back to the Achilles, probably like rolling your feet and then rolling your calves would be like the best way to, and
Maybe
stretching,
ribs.
and then stretching, you know, probably like help with any Achilles.
I actually use Theragun, and with the soft tip, it's like a really soft tip, and just go along the sides.
Oh yeah, Theragun is a great way too, guys. If you can get your client, because it can kind of relax. I think it's more of like a Golgi tendon organ thing, where it just kind of makes that muscle kind of relax a little bit, but it gives them the relief that's good for us, right? With that, I would say just additionally, kind of aside from the myofascial release, is whatever kind of stretching you and your client like. My favorite thing for the ankles and feet is all the FRC stuff. So like you can do ankle cars, like pails and rails, you can do hovers, all that kind of stuff. If you want to talk more about that, me or Lauren, I think Lauren might be a better source because she does it more than me. Anything else? Did that kind of answer your question?
Mm-hmm.
Anyone else got anything they want to talk about? Any old business, any new business? Cool, thanks guys.
Thank you for coming, guys.